wanted to show you, we always take a quick look inside to confirm the injury. And this is your torn ACL here. You can see these fibers are split. There's a split tear heading all the way back, up through there. And this lateral wall, we can just get all the way to the back of the knee through there, which is not normal. So we're going to go ahead and harvest the graft. We'll show you some more in a little bit. Pause, please. Okay, so we're just inside the knee here. We've already harvested a nice 8mm hamstring graft. This is the posterior horn of the medial meniscus. We want to take a good look here. Probe. And with our probe, we're going to go ahead and just feel this meniscus. Pretty stable back there. So I'm going to leave that alone actually. So we've taken out the torn ACL. The new ACL is going to run right up in the middle of the knee, right through here. Pause, please. Can I see a burn, please? Okay, so now this is over on the lateral side of the knee. A little bit of fraying on the radial edge, inner edge of the meniscus, but it's really minimal. I don't think we have to do anything significant to it. Very similar to the medial side. No significant tearing that needs to be repaired or resected. More than just making sure the edges are stable here. We'll keep working here, show you some more in a little bit. Pause, please. Okay, so now we're just making sure we have plenty of room for the new graft. I'm just going to run right in this direction here. And I'm happy with the way that looks here. Pause. Hold that down. Okay, so we've drilled the guide wire for the tibia. There it is right there. That's going back to the central part of the knee. So now we're going to drill over that with an 8mm drill to match the size of your hamstring graft. Okay, James, so we're just drilling the femoral tunnel to a depth between 30 and 35, right in the middle of those two hash marks. Gives us a tunnel about 33. And now we'll take out the drill. Here you can see that drill right there. Measurements, pause please. Okay, so here's the central part of the knee. You can see a suture that runs up through the middle of the knee, and that's the exact path that your new ACL graft is going to take, because we're going to use those sutures to pull the graft into the joint. We'll go ahead and load up the sutures outside the knee. Okay, so here we are pulling the graft into position. So there's our, what we call our endo button. Then there's some white tape behind it, and then that's the graft right there coming into view. So we'll get that seated up. You can see our little lines, so we know how deep to go. So here we are with the graft in position. We haven't fixed it yet on the tibial side. It's fixed on the femoral side. Just trying to clean up a little bit so we can give you a good clear shot. Okay, and so as we look at the graft here, there you can see it running through the central part of the knee as you straighten your knee out. It seats back in there nicely. Okay, so we're going to finish up here and fix this and get you back to the recovery room shortly. Really hope this does the trick for you, okay? Good luck to you now. Bye-bye.